Hey everybody, I have read your work from week 2 in post-it grades in the assignment rubric. Be sure that you open up the rubric and you read all of the feedback that's provided to you. If you ever have questions or concerns about something that I've said, or maybe it's not clear, or you want to discuss it further, always know that I'm here. I'm happy to talk about it. Just touch base and let me know what your concerns are. This topic of advocacy crosses every section of nursing. It is so important that that nurses at the bedside understand this role, but it is equally important that people at the executive level understand advocacy. As you move through layers of leadership, the who you're advocating for directly may change. So a nurse executive may be more directly involved in advocating for staff, whereas a bedside nurse may be more focused on advocating for the patient. In the end, all of our goals are shared. We want what is best for the patient and the healthcare community. Being behind that shared goal is pretty important. Many of you did a great job talking about the role of the bedside nurse leader, how important it was to be the voice of the patient at the bedside, which was great. A few of you touched on the importance of the role of the nurse leader at a management level, at a higher level, to really create a culture and an environment that supported advocacy. So both perspectives are really important. Your classmate Bailey wrote something that I thought was so on point. Bailey wrote, "One of the ways that a nurse leader can implement positive influence on this issue is creating an environment that promotes subordinate empowerment so that workers have the courage to speak up for the patient and themselves. With an environment like this, it will help other nurses speak up for their patients if they see another patient getting mistreated by a different nurse." What Bailey is getting at now is creating a culture, creating a standard expectation that when there's a problem, we speak up. Think about how often we see splashed across headlines that a patient had a wrong site surgery. And you wonder, like, how did that happen? How did a room full of OR nurses and scrub techs and physicians and other healthcare professionals actually let this happen? And so often it has nothing to do with the singular event of the physician taking a surgical site in the wrong place. What it had to do was a lack of empowerment of the team to question a decision. That very often when they go back in and they look at medical errors, especially in an OR, multiple nurses, scrub techs, anesthesiologists, they'll say, well, I wondered if that was the wrong side, or it didn't match up with what was in the chart, but I was afraid to speak up. I didn't want to be in trouble. I didn't want anybody to be mad at me. I didn't want to slow down our workflow. The dynamic of that environment, of a culture nurse leaders and healthcare leaders create, made the environment likely to have errors. So when we find our voice, it's great when we're at the bedside. It is even better when nurse leaders create a culture that voice of questioning something can not only be heard but respected. So lots and lots of great ideas this week. It's one of those discussion boards that I think is good for us to think about, and it's also interesting for me to read. So I appreciate having an interesting morning. I just want to touch on some highlight things. The quiz went well. You guys have figured it out, so you all are doing really well. There was one area in the quiz that was a hiccup for a few of you, and I just want to point out that there was a slide. Let me see if I can get it on your screen. Okay, here we go. It was the slide in the Module 2 presentation. That was the 5 components necessary for professional negligence to occur. Go back in and look at this one. I think what several of you got tangled up with was the second one here, which is the failure to meet the standard of care. The option on the quiz was to exceed the standard of care. And I want you to be aware that there is a difference. When we think about being held negligent, no one is looking for, were we remarkable? Were we exceptional? Did we do above and beyond? They're looking for the lowest common denominator. Did we meet the very minimum standard of care? And standard of care is normally set by whatever the policy and procedures are. What are the rules that guide that process? They use expert nurse witnesses to testify to standard of care, not exceptional care, not excellent care, not exceeding care. The minimum for negligence is, did they do what the policy said? No more, no less. So be sure that you know that difference, and be sure you know these 5 things. ATI likes them, NCLEX loves them, and from a professional practice standpoint, my hope is that all of you will be exceeding standard of care. But at a minimum, you need to be at the very standard of care. So I want you to know the difference there. Okay, what was number 3? Oh, let's talk just briefly about your leadership assignment. This is it is a worksheet. To clarify, you need to interview a registered nurse who is in a leadership position. And a leadership position is defined by someone who significantly contributes to someone's annual evaluation. So you need to find someone who's a nurse leader. And I don't care what part of nursing, or whether inpatient or outpatient or home health, doesn't make a difference. As long as they are part of the evaluation process of somebody and they have a leadership role, a defined leadership role, that's fine. And then to interview them, ask them questions. And it's your responsibility to know how to guide your person through the interview process and clarify their questions. So if you ask them a question and they don't quite answer it, you've got to reframe that and bring them back and make sure you get the information so that when you're typing this up, that you're able to answer those questions completely. So it's your job to find the person, make sure they're qualified, and then ask them good questions and help them stay focused on your question. The nuts and bolts, the heavy work of this assignment is the doing of the interview. I want you out there talking to somebody, engaging in the concepts of leadership. The after fact of it, the thing that lets me know you did what I asked you to do, is submitting a written assignment. I made this not a written paper. I made it a worksheet, and it is, let me see if I can pull it up. It is literally a worksheet. I do not want you to take this format and make it into a paper. Please don't make me read a paper. All I want to know is, did you ask the questions and what did they say? You're welcome to use bullet points for most of this, as long as your ideas are cogent, they make sense, I can understand them, and you're fully answering the question. You want to do paragraphs in the little boxes? Perfectly fine. Open this up as a Word document. Type in your person's answers in the box. Make sure that you give me that person's contact information so that I can verify that the interview was actually done. All of this is to me, this worksheet is what you're going to submit to Blackboard under the assignment tab, and this is what I'm going to grade. The rubric is posted. It's the last pages of the assignment. Begin to work on this now. The last module, module 4, and then that last piece that picks up the proctored ATI, doing those focused reviews is just tedious and time consuming. Don't let this be the other thing that you have to get done while you're trying to navigate the ATI practice and proctored test. Get this done as early as you can. If you're struggling with the process, if you're not real sure how to approach it, holler at me and let me know. One of the things I will tell you that people get tangled up with this assignment is ethical challenges. Make sure that you know what ethical challenges mean. And normally it is talking about something that occurs in the nurse work environment that creates a moral dilemma, where there's really there's 2 difficult challenges, no easy decision can be made, and it really is focused on the ethical outcomes of something. So be sure that you understand what an ethical challenge is and what ethics really are getting at here before you go in and talk with your leader. Sometimes your nurse leaders aren't going to be real clear about what you're getting at with ethical issues, and they give you process issues or policy issues, things that are black and white that there's a clear answer to. That's not an ethical dilemma. That's not an ethical issue. Those are policy and process issues. So be sure you have clarity with that. Okay, that is the worksheet. Let's talk just briefly about APA. One of your classmates, I want to say it was Anthony. Anthony, I'm not even seeing your name right. Hang on. Yeah, Anthony. I think it was Anthony that asked this question. Either way, come back to your Blackboard site. Look for, I added this tab because it was asked about. If APA is not your thing, if writing makes your head hurt, I get that completely. You will not be able to graduate from this program without being fairly comfortable with APA. You certainly are going to use it in your senior year, and several of your senior courses are going to require knowing this flow well. So I added the tab of writing and APA resources. If you're struggling with something specific, or you just want to double check something, there's a sample paper in here, and then there's the Al Purdue website. Al Purdue is a fantastic external website. You can click on it and you can search the thing you're not sure about. If you're struggling with level headings or how to use in-text citations, they're a really good source. They're easy to navigate, and they stay abreast of all the changes that APA puts out. The sample paper, I'll click on real quick just so you can see it. My computer is thinking about opening it. Okay, so the sample paper breaks it down in key elements. So you can go in here, pull this paper up, and you can see this is what a title page is supposed to look like. This is what headers are supposed to look like. This is what an abstract is supposed to look like. It breaks down what level headings are supposed to look like. In-text citations are right here. It's just a cool document. So just know that those resources are there. You really, aside from maybe your discussion board references, and then you've got one reference that's going to be in your worksheet, you're not really going to need a lot of that, but there's never anything wrong with just looking it up. The other thing that I would suggest you do, I've never met any of you, so I'm not sure how many of you are millennials who love technology versus people like me who constantly struggle to learn technology. APA, if you're on Twitter, APA has a Twitter feed, and I've linked it here. If you're on social media like Facebook, APA has a style blog, and all you have to do is follow them. And they send out routine updates or reminders, hey, you know, don't forget that this is how you do this. It's just another way to polish your writing. I realize that there are so many more interesting things to look at in Twitter and Facebook, but it's an option. So just know that it's out here. I've linked them here. The other thing that is here is Crossref, which is a website that helps you find DOIs of articles. It's not going to be a big deal with this course. If you're with me in 425, I'll talk more about this. Just know if you need a DOI, you can use this, and it's a pretty intuitive site. Okay, the last thing. I think that's the last thing. Oh, no, it isn't. If you're curious about what your faculty member do all summer when we're not sitting in our offices, I thought I would share with you what I did. This is baby Holly. Some of you have already seen seen a picture of her. This is the grandbaby who is 4 months old. So I am babysitting. Not every day. Every once in a while I get to see her on Friday nights. And every once in a while it's bath night. Bath night is very cool when babies love water. So this is what I am. This is some of what I'm doing. And I am a neurotic organizer. So I'll show you my last project because I know that you're dying to know this. I organized my utility closet. I think it looks fabulous. I haven't put all the labels on everything yet, so it will be even more fabulous in a couple of days. So my hope is that you are doing something slightly more exciting than organizing a utility closet. I do hope that if there's a baby in your life that you're loving on them, they are super cool, especially when you're the Nana. I don't know if any of you are nanas, but if you are, it's fabulous. If you're a mom, even better. If you're an aunt, uncle, parent, wherever you are, babies are great. Let me know how you are. If you have questions or concerns, if you're struggling with something, know that I'm here. Be in touch with those concerns. This course is flying. So the sooner we talk about any issues you're having, the sooner we can help resolve it. I will be in touch next week about the work that you are expected to do, and I'm around. Take care.